So physically, I really concentrated on being as active as possible each day. That served several purposes. It got my mind off things. Plus, there's just a really positive benefit to movement each day. However, I was very sick going into the lung removal surgery. So each day I tried to do what I could. It involved strength training, lifting whatever weights I could, some cardiovascular exercise. I used a stationary bike. I also took frequent walks with my dog, and that provided a mental and a physical benefit. Now, mentally, what did I do? I used distraction, I used prayer, and I used music to help keep me in the best mood possible. Distraction for me included mindless, repetitive tasks, such as cleaning and organizing my house. Now, what would have been perfect if it was summer and if I could go out and weed the garden, that would have been perfect, but it was too early in the year. So I had to settle on organizing and cleaning my house. Prayer time consisted of reading scripture and praying over myself. I did this throughout the day, and it provided a tremendous mental benefit for me. And then I used music. If I was anxious, I would use soothing music to calm me down. If I was depressed, I would use upbeat music to lift my spirits. Now, nutrition-wise, I didn't do anything special. I ate what I could. I I thought calories were important, so I just concentrated on eating what I could eat, what tasted okay to me. In my role of patient services, I see we've made great strides in putting those sort of plans together for patients, you know, here in 2025. But back when I went through, I was not aware of anything like that. I learned of my procedure after the mediastinoscopy, and the surgery was scheduled, and they proceeded. So any sort of plan was more generated on my side than by my medical team.